Bienvenidos y bienvenidas a Frugal for Health, una iniciativa que busca dar a conocer proyectos frugales de todo el mundo. Si esto de la innovación frugal aún no sabes de qué va de hacer más con menos. Y te dejo un vídeo de Navi Rajau que lo cuenta muy bien cómo hacerlo en el sector salud y social. Hoy me encuentro en Embara para conocer el proyecto Cante, una incubadora de proyectos en salud tecnológicos que está aquí en el sur de Uganda y que ha conseguido tirar adelante bastantes startups de salud. También han desarrollado una escuela de robótica infantil y les hemos preguntado si en cierta forma también son un poco frugales. Podéis quedaros a la entrevista, pero si os gusta hemos preparado un debate con diferentes agentes del sector para profundizar sobre el tema. Hasta pronto.
Well, my name is
I am Ronald Dorian.
I don't like to rehearse.
My name is Nambogo Nuriat. I work with the Consortium for Affordable Medical Technologies, CAMTech Uganda. CAMTech Uganda is an innovation hub that was established in 2012 following an MOU that was signed between Massachusetts General Hospital and Mbarara University of Science and Technology. We are more specialized in supporting innovators in health, right from idea or challenge identification all through to commercialization. We have supported quite a number of innovators. We work with them the journey from identification of the challenge, where the avenues through which we get these challenges is through the medical technology hackathons, then the challenge calls that we send out and people will apply and submit the challenges, and innovation cafes where we get people together. All these are themed. We identify an area that needs attention or solutions, and then we create a theme. So from there, we have innovators move into the innovation support office, where we practically guide them on how to put together a concept that defines the problem, the technologies, that solution that they would like to provide, the business model, because we don't believe in charity solutions, so it should be self-sustaining, your team, and who you intend to partner with as you move this journey or you walk this journey of developing and also commercializing your product. At CAMTech Uganda, we have more than 10 companies that have stemmed through CAMTech Uganda. We have had innovators file for IP, both at country level but also at international level. We have had innovators employ each other, so we have more than 216 jobs that have been created by the different innovators on their projects. We have gotten funding. Innovators have been competing for funding. So right now, I think it's more than $15.5 million altogether that innovators have been gathering and also helping them to develop and test their products. We have a number of innovations that have been deployed in health facilities in Uganda. One has, I think, been deployed, which is a technology to support low-level health workers or health workers at low-level health facilities where we cannot get a pediatrician to manage a sick newborn. So this is in more than 62 health facilities in Uganda, but it has also been scaled up in other African countries. We have quite a number that have even crossed from Africa to other countries like India. And we believe that our model is working because we started it, we tested it, and it has been proved to work, or it has proved to work. I think the innovation space, especially in health, is still a little new and a little different from when someone is developing another type of solution. The medtech space requires someone or the innovator to embrace the design thinking approach as much as possible, because you need to engage the end users, you need to do research, you need to do clinical trials. If it's a device that you're developing, nobody is going to allow you to take this device and use it on a human being without getting the necessary approvals. So this is a space that requires patience, but it also requires key players to come in and support this innovator. Otherwise, it becomes lonely and the innovator can end up losing it or dropping it. So this space is still new, however, and also there are few hubs that are only specifically concentrating on health. Most hubs are doing general and medical technology innovation. Somehow it is different from an innovation, for example, in agriculture, an innovation in like entertainment, an innovation in for example, education, because there are regulators, there are few, but when it comes to health, there are many regulators. NDA will come for you, research ethics committees will come for you, and they will say, before you test this on a human being, you need to pay for their medical insurance, health insurance, and if it's a device that you're going to use on a human being, there are many regulations that come into play, and you have to respect them and adhere. And as an innovator, I think there is a lot of support that is needed into this. From experience, young people, not only young people, we have great brains that have good ideas that can come up with solutions that that are catering for our own challenges. You need a multidisciplinary team. If it's an innovation in health, maybe a solution that is providing care or trying to improve something on neonates, you'll need a pediatrician, you'll need maybe a nurse, you'll need a business person to advise on that business, you'll need that person from engineering, whether software developer or someone who will help you develop or guide on how to develop this solution. You will need all the types of people that can help you move this solution. So we have all that here. We are also next to a teaching hospital, a regional referral hospital, that is Mbara Regional Referral Hospital. It's a walk away. It's within most lecturers who teach at Mbara University of Science and Technology, they also work in the hospital, especially those in the health field. So you find it's easy for us to tap on someone, please come and guide on this, because we can't do it alone. So, and also we have other facilities. Challenges are full, health challenges. There are so many health challenges within the hospital setups. The doctors can tell you about the challenges. The nurses can tell you about the challenges. The patients themselves, they will tell you about the challenges they are facing. Most funders don't want to fund innovations that don't have a proof of concept. So you'll find most funders are funding already products that are working or a prototype that has a proof to work. So for us as CAMTech, we start from idea, we support the innovator and move with them through their journey. So the seed grant that we've been giving out is just to support them have that proof of concept and tell the world, look, this works, I have the data, it shows that this can work, I have the innovation, I can test it, I can even show you a video that it works. So can you please give me more money to do ABCD and maybe also do clinical trials, improve on the version that I have for a better version that I can take to a facility for a clinical trial, after the clinical trial that I can now deploy for use. So yeah. So we started recently a robotics for kids program that targets the primary level children, but also secondary level children, but also university interns that want to concentrate on just robotics. Because a child of like a 7-year child that can make, for example, from at their age, they can be able to make, for example, an automatic light, that can be able to make like maybe to control traffic lights, and they have built it from zero. That is so exciting, and you're sure such a child will continue like getting interested in this, and they are creative. They think I can also do something. Yeah.
Hello, my name is Ilemut Evan, and welcome to CAMTech Uganda, where I work as a robotics program coordinator. So far, for the 2 years of operation, we've been able to train over 90 children in this program. So the trainings usually happen during school term holidays for a duration of 2 weeks. During that period, the children come into our co-creation lab, and then they tinker with the electronics, put together projects that solve some of the community challenges. And at the end of the training, we invite their parents and other guests to come and witness the work that the children have done. I think currently robotics is not well appreciated. Many people don't understand the impact of the robotics program, but also we have limited expertise in terms of the robotics instructors and robotics or technology educators to equip these children and university students with hands-on practical skills, particularly in skills to deal with the fourth industrial revolution. You're talking about robotics, you're talking about the Internet of Things, and you're talking about AI. Yes, so the robotics program here at CAMTech engages children with basic kits. Mostly we use Arduino for the trainings, but also we utilize locally available materials during the fabrication process. They do cutting of boxes to come up with the different projects that they want to build. One of the things that we do during these trainings, we use open source software for their trainings, platforms like Tinkercad, Fritzing, to help them learn without first interacting with the hardware. And then we now take them to interact with the hardware components, and most of the components that we use are reusable. The Arduino kits are reusable. They can put together a project and then disassemble it, and another person can still be able to use this. And so find that over time, we're not spending more on buying components, but we reuse what we already have. So currently, we run advertising for this program, but also we are partnering with, we have a student chapter at MAST, the Institute of Electrical and Electronics Engineering student chapter is at MAST. So they reach out for partnerships, they identify those schools in rural settings, and then we can go and do a workshop for a day or two.
Esto ha sido todo de la iniciativa Camtech, una incubadora de proyectos en el sector salud y que también tiene asociada una escuela de robótica para niños. Muy interesante, seguiremos de cerca y si queréis ver más podéis profundizar en el debate que vamos a realizar. Para más vídeos, síguenos en nuestro canal. Hasta la próxima.